Calling the meeting to order. If you could please make your introductory remarks, Martin.
Yes, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live-streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you. If you would kindly call the roll.
Yes, Mr. Chair. Sean King, Chair.
I'm here.
Thank you. Deb Poland.
Here.
Sheldon Taubman. Elisa Naira.
Here.
Thank you. Maria Matos. Ms. Matos. Jacqueline Sanchez.
Here.
Thank you. And Gerald O'Sullivan, subject matter expert.
Here.
Thank you.
Great. And then if we can have our Access Health leadership team introduce themselves also, please.
Good morning, all. James Michelle is here. Mr. Chair, I will have to leave early. I have a press conference to attend with the governor at 11 o'clock, so I'll probably leave around 10:25. I switched to my phone on my car.
Okay. Thank you, James. Welcome.
Good morning.
Good morning.
Oh, go ahead.
Good morning. Holly Zwick, Director of Finance, Access Health CT.
Good morning. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Good morning. Kelly Cody, Manager of Plan Management.
Is that everybody?
Yes, it is.
Okay.
Mr. Chair.
All right. So we'll move on to our next item on the agenda, public comments. My understanding that we have not received any public comments.
That is correct, Mr. Chair. We did not receive any public comments.
Okay, so then we will move forward then to the review and approval of the minutes of our December 4th, 2025 meeting. If I could get a motion to approve those minutes.
So moved, Mr. Chair. Deb Poland.
Moved by Deb. Is there a second? I will go ahead and. Oh, go ahead.
Second, Elisa Nada.
Okay, seconded by Elisa. Are there any comments or edits to the minutes? Hearing none, Martin, if you would call the roll to approve the minutes.
Sean King.
Yes.
Deb Poland.
Yes.
Sheldon Taubman. Elisa Naira.
Yes.
Thank you. Maria Matos. And Jacqueline Sanchez.
Yes.
Thank you.
Okay,
Motion's
so the
approved.
motion carries. Minutes have been approved, and now we are going to get to the heart of our discussion today. And first up is going to be Tammy with the Health Equity and Outreach Department update.
Yes, thank you so much. Good morning, everyone. This is our first meeting for the year, so happy New Year. Tammy Hendricks, Director of Health Equity and Outreach. We've had a very successful year for our team and as an organization. We have been seeing the demand for in-person enrollment continue to increase as we build relationships with community partners throughout the state. So to keep up with that demand, we hired a new team, and I know I've presented on this before, a mobile enrollment team. And this way we were bringing more consistent in-person enrollment opportunities throughout the state. So I'll start off with some highlights and I'll go through some of the numbers. This was our first full open enrollment period with our mobile enrollment team. We served over 2,000 consumers across the state. We were in 40 towns, and we held 164 enrollment fairs and events throughout the open enrollment period. We also had our 6 Navigator locations. They saw over 1,600 consumers who needed help enrolling. But with our navigators, not only do they do the enrollments, but consumers have access to the other services and resources that they offer. So our navigators are a critical part of our outreach efforts. Now, with all those numbers, and because we had a bigger team, we had to find a more structured way to host our enrollment events and making sure that consumers had a pleasant experience and reducing wait time. So last October, we launched a new scheduling tool that allowed consumers to book appointments online to see us in person instead of waiting, which typically our enrollment fairs are walk-ins or they RSVP, but they have to wait. It's first come, first served. So this scheduling tool page had over 16,000 visits, and we generated 892 appointments during the open enrollment period. And the appointments filled up. Almost 90% of the appointments were filled by November. So consumers really love that option of having a specific time to walk in, get the help that they need. But it also allowed for a little bit more time, 45 minutes to an hour. So we're able to educate consumers during this time as well. We do have another enrollment page that lists the enrollment fairs, and the fairs are typically after hours or on the weekends. And we also, on this enrollment events webpage, we also have the information for our navigators. And that page saw a significant jump in visits as well, seeing over 11,500 visitors. So the demand is there. We are working on more efficient ways to improve the in-person enrollment experience. As you all know, the folks that come in person are typically they typically need a little bit more help and education. So we try to make this a seamless experience. So we're working on adding new features to the scheduling tool. And so I'll pause here if there are any questions before I move on. Okay. Seeing none, we'll move on to the next. All right, community partnerships and outreach activities. So not only did we see a growing demand for in-person enrollments, but our partner list is growing significantly as well. We now manage 2,965 community partners contacts. This is up from 2,500 at the start of 2025 at the start of the year. And just a few highlights, we do a lot of different collaborations and partnerships with our community partners. We attended over 400 events throughout the state. We went on 427 site visits to community partners. We go to their locations, we check out their services and see what they're doing for the communities. And we also conducted 94 virtual presentations. This includes the monthly Healthy Chats that we host for consumers, as well as a monthly update that we have for our community partners. Overall, in terms of visitors for the events that we host as a team, we had almost 2,400 RSVPs to our events. So shows very strong engagement from consumers and community partners alike when we host our events. I will pause there for any questions. My final slide, I'll cover the CAC program and Broker Academy. Our CAC program, the Certified Application Counselor Program, continues to grow. We are continuing to promote that to qualified community organizations. Similar to our navigators, our CACs are trained every single year to be able to do enrollments at their organizations. As of right now, we have 209 certified application counselors, and they are across 37 or 38 organizations. And many of those organizations are health centers, and community-based organizations, but we are trying to engage with more hospitals this year. We recognize that this program, it can be a little bit difficult for hospitals to start up, but it's very possible. So we are focusing on adding more hospitals to that list. And my final update is on the Broker Academy. We are going into our 5th year for the program. The program continues to grow. Our graduates support us all year round and during open enrollment at all of our events. It's truly, it comes full circle with this program. So 2025, that was our most successful class to date. We had 29 students passing the state exam. And so planning is underway for year 5. We have applications opening up next week. And we continue to promote the program all year round. We started to host some info sessions this month, and we have close to 80 leads. And that list continues to grow for the program. So looking forward to that. We are going to host 2 class locations in the Hartford and New Haven area. And this is based on website analytics, the leads that we're getting in, and some feedback from our community partners and students. But once those locations are finalized, we can officially announce it. So more to come on that. And that concludes my presentation. I'll pause here for any questions.
Any questions or comments for Tammy? Deb's got her hand up.
Deb.
Go ahead, Deb.
Thank you. I just wanted to make a comment that the CAC recertification process this year went very, very smoothly. And so kudos to your team. There have been some glitches in prior years with people waiting extended periods of time to get their new number, or being just having trouble accessing the portal to take the exams, and everything went just really, really smoothly this year. So thank you to your team for that.
Thank you so much. And I will let the training team know. They do a wonderful job every year updating the content. So a huge team effort on that, and I will let them know. Thank you for that feedback.
Sure.
Thank you, Deb. Anybody else? I'll just reiterate also my appreciation for all of these various outreach efforts, all the work that goes into Tammy and your team to getting out into the communities and making those contacts and assisting all of those individuals. It's important work, and I think what we're about to find out is that the work does yield a lot of benefits when we get our update on open enrollment from last year, because these numbers that we're about to hear, I think, are a little bit better than what we might have expected, given many of the changes at the federal policy level and losing the enhanced tax credits. But before we get into that, I just want to be mindful of James's time constraints and see if, James, do you want to take your strategic initiative update out of order just so we can get
absolutely.
you in before you have to leave us? Yeah, let's go to that.
Absolutely, next. Very quickly. So we have 2 big projects that we are currently working on. Number one, the 10 clicks. I think I mentioned before, currently the application process our customers use to enroll in health insurance, whether it be Medicaid or QHP, it's extraordinarily time-consuming and complicated. And it's also the same system that we've been using since we started back in 2013. Right? And we have not made any major changes to it. Simply, the system is just too complex and also very expensive to maintain. So we started about a year and a half ago, almost 2 years ago, to do some research and study. We polled our customers, we polled our vendors, we polled our employees, and we also polled our partners who use our system to figure out exactly to get information from this to exactly what areas of our system is complex, is too difficult, too challenging. So we gathered all of that information. Based on that, we created an RFP with a scope of work that will create a brand new system for us that we call 10 clicks. The intent here is to have the average person go through the system in 10 clicks from start to finish. It is an aspirational goal, but the intent is to make it as easier, as efficient as possible for people to enroll in health insurance. And some of the questions, some of the information we got from polling, some of the folks that Pullman work with continuously, they've always wanted certain access to the system. Because we are designing a brand new system, we'll be able to create a portal for that population to be able to do what they do to help customers more efficiently, more effectively. Because as you know, right now we only have two portals available. That's a worker portal and a consumer portal. And then the worker portal has gives you unfettered access to our entire system. And we are forbidden from IRS and CMS rules to kind of give that level of access to anybody who is not part of Access Health. But in the new environment, we'll be able to create specific portal for specific groups or who help customers. So that more help will be available to your folks in the new environment. So again, we polled just some of your folks as well. They made it very clear to us, and we knew that going in to the survey, that we would have to make it easier for our partners that Tammy talked about to enroll people to our system. Again, for both Medicaid and QHP. So that project, where it's at right now, we issued an RFP. RFP came in, we evaluated the RFP. We have had all presentations. And by the end of the month, we will, by mid-March, early April, by mid-March, we will award. By early April, we will have a vendor selected. Then we will start the process of building a brand new system for to enroll. I cannot overstate how risky that is for our organization, right? Because we're talking about changing how we do everything. Remember the old system that was built back in 2012, 2013, we had no information about our customers. The rules that we were implementing were being created by CMS as we were building the system. So the system has a lot of inherently inefficiencies in it because we didn't know anything about our customers, about how the system was going to work. Fortunately for us, in the new environment, we have a lot more data about our customers, about our employees, about our partners. And also, most of the rules have been created and set in. So we'll be able to create something much more efficient with a lot less inefficiencies built into it because we know what we need. So we are looking forward to that. And the goal is to have this up and running by July 2027. So that's where we are with that. Business Plus, as you know, is a system we went live with last July 1st. And this is for small businesses and to give access, to give their employees access to the QHP environment. So if you are essentially a business, and any size business, you could come into our system, and if you qualify, some of your employees may qualify to get health insurance through Access Health, which will lower costs for you, for the employer, as well as the employee. So we're excited about that. That's going on right now, and again, we are about 90% of our target. It's just getting started. Right now, John Carbone and his team is spending a lot of time going around talking with different organizations that will give us access to the employees. Right now, we are targeting small nonprofits. A lot of small nonprofits have a lot of frontline employees who are low-income earners. We think most of them would qualify for subsidized help on the exchange. I'll pause for any questions.
Any questions for James? Hearing none. James, thank you for the update.
Thank you very much. All right, so I will log off now. I'll log on my phone when I get in my car as I drive to the press conference with the governor.
All right.
Thank you all.
Thank you, James. Appreciate the update. All right, so back to the order of our agenda. Item E is our open enrollment 13 summary, and looks like Catherine Hearn will be taking it from here.
Thank you, Mr. Chair. Good morning, everyone. I'm Katie Hearn, Associate Director of the Enterprise Project Management Office, and I have a brief open enrollment status update for you. Yes, we were very pleased to report that our qualified health plan enrollments exceeded last year's, despite the headwinds. Overall, at the end of open enrollment, qualified health plan enrollment numbers totaled 157,175. The prior OE, we had 151,152 enrollments. So we saw more than an 8% increase in QHP enrollments year over year. This is a snapshot of the OE periods year over year. And here's the breakdown. With the expiration of the enhanced premium tax credits, there was a large increase in customers without financial assistance, 32,847 this past OE. That was about a 116% increase over the prior period. Qualified health plan enrollments with financial assistance, including Covered Connecticut, decreased by about 8.5%, totaling 124,328. However, the Covered Connecticut program on its own did increase by more than 25% with enrollments of 51,629. And we also had a significant uptick in our standalone dental plans. Enrollments totaled 19,416, an increase of about 13.5% over last year. Again, these open enrollment numbers do not reflect the 2026 temporary premium assistance from the state of Connecticut. Plan management manager Kelly Cody will be giving you some updates on the temporary premium assistance program, and I'll pause here.
Any questions for Katie? Deb, go ahead.
Yeah, thank you so much, Katie. And I think we're all both excited to see these numbers and confused. I think there was a lot of concern around what's happening with the subsidies, the enhanced premium tax credits. Obviously, there was a lot in the news around the dramatic increase in costs. So to what do you attribute this increase?
I don't know if I'm qualified to speak to that, but I can certainly take that back.
Deb, can you repeat your question, Deb?
Yeah, I'm just saying, we're all excited to see these numbers, but I'm also very surprised that with the expiration of the enhanced premium tax credits and the dramatic spike in cost, that we had an increase in enrollment this year. There were a lot of people who predicted that we would have a lower enrollment this year. And not only did we not have a lower enrollment, but we actually had a higher enrollment. So I'm wondering why we think that happened.
We did extend open enrollment.
We do have one minute, Katie. We've analyzed that. We know why. One of the big reasons is the fact that, as you know, the tax credits are calculated based on the second lowest silver plan in each county. It just so happened that this past year, for 2026, in all 8 counties, the second lowest premium went up by 23%. It was approved by CID, on average about 21-22% increase for those premiums. That drove up the APTC across the board for anyone who qualified for APTC. It was a lot higher. And that's probably the biggest reason. So some of our customers' net premiums actually went down because they got higher APTCs than they got in 2025 because the increase in premium for the second lowest in all the counties went up dramatically, and that drove up the APTCs for everyone, which reduced their net premiums for 2026. That is the biggest reason.
But then even people who didn't get a subsidy, we had more of them. It's just very interesting.
That happened because we have a lot of auto enrollments that happened. But also, we think a lot of folks they see the value of health insurance. they've had it since 2020, 2021. And not even the premiums went up. One of the things we're going to do there, we have about 14,000 folks who did not re-enroll with us from that group, and we are going to do a survey to find out why they did not re-enroll. But those numbers went up because we did a lot of marketing. Remember, we started talking about the potential loss of enhanced subsidies since February of 2025. So we spent the entire year doing a lot of outreach, sending a lot of notices, and telling a lot of folks that the value of health insurance, and we leverage our brokers to help educate, answer questions, and so a lot of folks, a lot of them, they had a silver plan this year. They had a bronze plan. So we are looking at the numbers now to see how many people went down because they just could not afford the same thing they had last year because they increased premium. But the biggest driver of our numbers staying as high as they did, number one, cover Connecticut was a big one, and the other one is the fact that premiums, the elder premiums went up dramatically, but that also drove up the amount of subsidy people got because of how the calculations because of how the APTCs are calculated. That has, and we were surprised as everybody, well, as all of you are, but we're very fortunate. Maybe the timing of the increase for one of the plans on the exchange that drove up the tax credits for everybody across the board. Biggest reason, that's probably the biggest driver. Our numbers being as high as well. And also the fact that we did a lot of marketing. And Tammy, Tammy spent a lot of time, her and her team spent a lot of time and energy going across the state, answering questions and helping people to enroll as quickly, as easy as possible in anticipation of the challenge people are going to have. So we had about much more in-person presence across the state. So we think everything in combination helped us to sustain these numbers and increase them by 4%. By far, the biggest driver was the increased tax credit as a result of the increased premium for the second load silver across the board.
Thank you.
My question has to do with the temporary premium assistance, and maybe this, we can defer this until Kelly's done with her presentation as well. But so I'm curious about a couple of things. Number one, you said that there's not really a breakdown in these numbers, kind of singling out those individuals who are getting the temporary premium assistance. But how do are we going to be able to kind of break those folks out in maybe the next report that we get, so we get an understanding of, are these going to be included in QHPs with a subsidy or QHPs without a subsidy in future reports? How are we going to kind of align those with our current reporting?
Hey, Katie, can you explain the breakdown? Well, I know you said breakdown of individuals and households.
Yeah, I have those numbers. But I understand. In the future, I think we'll break it out and we'll indicate temporary premium assistance, right? I think we'll make that distinction from APTCs and CSRs. I think that would be the best way to do that, and going forward. I do have some basic numbers on individual enrollments and households who have received the state subsidies, which I can give you. I don't have them broken out by income cohort, however, but I can give you sort of those top line individual and household enrollment numbers. The individuals enrolled with the temporary premium assistance right now are at 17,612, and the households are 10,096. But in the future, we will have more specific data to share.
If you want me to determine, there are two cohorts that qualified for this, 100 to 200%, who don't qualify for Medicaid, and the other one is above 400%, up to 500% of the FPL.
Right.
That's the breakdown that we that we're calculating now. So we'll have them ready for you at the next board meeting or at the next meeting, next time this group meets. But we do have the number of people who are enrolled.
And right now are the majority or all of them included in the without subsidy category or the with subsidy category on this chart?
But now they'll be in the without subsidy.
Okay, that makes sense because that seems to
because
align with the numbers we're looking at. Yeah.
Right. That subsidy, without subsidies, without any federal subsidy.
Right. Okay.
Just, there.
Yeah. And then I have more questions about that. I think maybe this will wait till after Kelly's done, but just about how it's communicated to those folks. You know, what the difference between the temporary premium assistance subsidy that they are receiving now and versus what they were getting from the federal level before, and how they need to plan for how it's different in terms of the end of the year activities that they have to do. So the federal subsidies they had to reconcile on their tax returns. This one, I'm not really sure what they need to do with it, if anything, at the end of the year. So that's something that I'm curious about, and what the messaging is around that.
Yeah, we've worked with DRS and DRS lawyers. There will not be any reconciliation with the state for the TPAs.
Okay.
And we other states are doing the same thing. We've spoken with them, and there will be no reconciliation required for the TPA with the state of Connecticut.
Great.
Right. But also the communication part. There's a lot of communication going out to not just to the folks with TPA, but also we have a number of folks who were enrolled last year who qualify for TPA but did not re-enroll this year. All right, it's about 14,000 plus, and we have been sending them notices, email, and texting them, making them aware that this new subsidy is available. That will reduce your premiums. Again, based on our calculation, we know what the reduction will be. So that's been gone. Those notices, notifying them have started. I believe this week or last week, going out to the 14,000 plus folks who did not come in and enroll at all. Now the 17,000 folks that Katie talked about are folks who weren't actually enrolled. We're paying full premiums. So we spiked them out and sent their names to their carrier. The carrier is going to adjust the billing going forward. So they are enrolled in TPA, and the carrier have that information. So the next billing cycle, the bills will be adjusted retroactive to January 1st.
Okay. And so that's the billing cycle for April 1st.
The carriers, they all have different billing cycles, and depending on the type of customer you are. So billing cycles will be next week. It depends. The carriers, every carrier have different billing cycles for different customer types. So I don't know what the billing cycle is for the carriers.
Mm-hmm.
But the next billing cycle that our customers are part of, they will see an adjustment to their premiums, retroactive to January 1st for the TPA.
Okay, that's helpful, James. I appreciate that, because those of us who are interacting with people who have questions, we can share that with them when they're wondering why they're still paying the full price for their premiums when they qualify for TPA.
Maybe we'll create a one-pager, send it out to you, showing you and your team. You probably get calls. We do have information for our call center, so when they get called, so maybe we'll share that information with you, so that the customers who call you and call us will get a consistent message answer.
Yep. Yeah, we appreciate that. Thank you.
Okay. All right.
Any other? Lisa has a question.
Yeah, the communication will be continuous, don't stop. And one more point I want to make, Deb, you and your team, everybody be aware of. One of the rule changes in HR 1 is that there used to be caps on the when you reconcile with the IRS on your taxes. There were caps as to how much they could recover. Those caps were removed by HR 1, which means that if you came in and you updated you did not update your income and your income jumped dramatically, but you continue to get APTCs when you reconcile at year end on your taxes, there were limits that the IRS could recover from you, and they were relatively very low. They were put in to protect folks. Those caps have been removed, which means that if you did not update your income and you continue to get large APTCs, and when you file your taxes next year, you may owe thousands and thousands of dollars, right? Because the caps have been removed. So we will have a campaign throughout the year reminding everybody, please come in and update your income if things change for you, or if you are working, or if you're a small business, you got a big contract, your income is going to be jumped. It's going to be increased dramatically. You got to come in and update your information so your APTCs could be adjusted accordingly. If you don't do it, you may owe a lot of money to IRS next year. So I just want to make sure you're with. Again, we'll monitor that, but we are going to continuously communicate with all of our customers that are receiving APTCs, again, to avoid them owing the IRS a lot of money next year.
Thank you, James. Elisa, you had a question for Katie?
Thanks, Sean. And not so much a question, but I just wanted to highlight the Cover Connecticut enrollment numbers and that 25% increase. OHS, as part of our efforts to really complement Access Health, CT, awareness, outreach, education, assistance, we have been focusing really on targeting outreach and engagement efforts to particular groups of people we know may be eligible and not enrolled. So, that includes childcare workers, personal care assistants, per diem school staff, parents and caregivers who may be low to moderate income. And so I just wanted to make that note. We ran you may know this, a very targeted marketing campaign at the end of last year from September to the end of the year. But I also wanted to kudos to Deb and your team of community health workers who have been also all over the state of Connecticut, really really paying attention to these populations and outreaching them. So I just wanted to recognize them for their efforts, and it's really great to see this increase.
Thank you for that.
Thank you, Elisa. All right. Seeing no other hands, let's move on. We'll turn it over to Kelly for policy updates and 2027 plan year planning update.
Good morning. Again, I'm Kelly Cody, Manager of Plan Management. I work under Susan Richby. So updates. As many of you are aware, the federal enhanced premium tax credits have expired December 31st, 2025. What's impacted? Consumers with income between 100 and 400% of the federal poverty level, which I'll refer to as the FPL from this point forward, remain eligible for the federal advanced premium tax credit, or APTCs, but at the original contribution levels. However, those with income of 400%, over 400% are no longer eligible for APTCs in 2026. And I think that's something that we all started discussing earlier in the call. And also noted on here, and we've already talked about, is that strangely enough, because of the way the silver premiums had been calculated, they definitely had a positive impact to the overall APTC calculations, and having a positive outcome for several consumers, which has had an impact to our increase in membership for this year. So, again, I don't think we need to belabor this discussion point, but certainly was unexpected. If you could go to the next slide. So the temporary premium assistance, we started talking about this as well. So some of this might be redundant. Many of you are aware of the government or Governor Lamont communicating the financial assistance. This program is aimed directly at those individuals that were impacted by the changes by the federal government. So it really zooms in on consumers with income at 100 to 200% FPL and are not enrolled in the covered Connecticut program, and consumers with income over 400 and up to 500% of the FPL, which it replaces about 50% of the expired enhanced subsidy amounts. So it's not 100, it's not going to cover it all, but at least it is giving something towards those individuals who effectively have lost all of that benefit. The next slide, please. So some little more detail around the temporary premium assistance program. And I think, Sean, you were starting to get into some of these questions. So, again, any of the individuals that were enrolled in the plan effective 1/1, if they became eligible for this temporary premium assistance, their premium will be adjusted back to the effective date of January 1st. There is also a special enrollment period that has been created for those individuals who either did not enroll in a plan effective for 2026 because of the cost of enrolling in that plan, or if there are individuals who did enroll and then realize after the fact that they're eligible for this temporary premium assistance program and they'd like to change plans. So there's been lots of communications that have been sent out to consumers, as James alluded to. But at this point in time, the process is all manual. So there's a lot of work happening between Access Health Connecticut and all the issuers. They're sending manual files to make sure that these people either do get the credit if they're eligible for it, they're able to re-enroll into a different plan through the SEP process. So until those manual workarounds are done, the carriers are accepting all of these files. They will go back and correct their invoices so that consumers will get updated invoices to reflect the credit that they are eligible for. But as James alluded, it really depends on when the person enrolls and at what time the issuers run their monthly invoices. So we do have intentions in sometime in March that the system will have the functionality to support the process, this new special enrollment, but until then it is a very manual process. Are there any questions on that? Okay. Well, I have a very quick plan year planning update. And Sean, you probably are very aware of what's going on. We have had one HPBQ meeting, Health Benefits and Qualifications meeting, where we've discussed what we would like to do for 2027. At this point in time, CMS has released the Notice of Benefit and Payment Parameters, otherwise known as the NBPP. That is in proposed status. We have until, I believe it's mid-March for everyone to review that documentation and provide commentary back to CMS. Unfortunately, we are not in receipt of the actuarial value calculator, which is very vital to our entire process. In normal years, usually that calculator comes out at the same time the NBP does. For some reason, it hasn't yet, and so we expect that. We're hoping at some point it will be coming out, but it doesn't look like it's going to be like a March timeframe. So any of the planning sessions for the HBBQ really have been kind of pushed back. And so we don't really have much of an update as far as plan design or changes for this year. But I would like to note that, the one meeting that we have had so far, the focus clearly is on the cost of plans and how we can try to mitigate some of that. So I'll pause there for a minute if anybody has any questions with plan year planning. No? Okay, well, thank you for your time.
I will just comment with the plan year planning. We understand we're sort of at the mercy of the federal government to get that moving along, and appreciate everybody's patience who's involved in that process, and the focus that has been given to, I'm sure very quickly and as much as possible, trying to understand and digest all of the proposed modifications. There's a lot in there. I don't fully understand all of them. I haven't studied them all probably as much as you have. Hopefully they walk some of them back, because there's some ugly ones in there, but appreciate that.
Oh, no problem. It will certainly be an interesting year. So but we'll get through it. So thank you.
Yeah.
All right. Take care.
All right. So we've already heard our update on strategic initiatives. Unless there is any other comments or questions from members of the committee, we'll entertain a motion to adjourn.
So moved, Mr. Chair. Deb Boland.
Moved by Deb. Is there a second? I'll second. Any discussion? No discussion. All in favor? Let's have a roll call vote. Martin?
Yes, roll call vote. Thank you, Mr. Chair. Sean King,
Yes.
Deb Boland,
Yes.
Sheldon Taubman, Elisa Naira,
Yes.
Maria Matos, and Jacqueline Sanchez.
Yes.
Thank you.
All right. The motion carries. Thank you so much, everybody. Good conversation
care.
today. Have a great day. See you all soon.
Thank you. Bye-bye.
Thank
Bye-bye.
you.